So I want to take a few minutes to talk about preoperative analysis and with patients that are very asymmetric and how we do some vector 3D imaging to talk about what they're going to end up with afterwards and how accurate that is. So this is a patient that, as you can see, she's very asymmetrical before surgery. She wants to have augmentation, but more importantly for her is symmetry and having symmetrical breasts in terms of enhancement. So we did vector 3D imaging, and as you can see, her results look really good on 3D imaging, and we want to now replicate that surgically. So the idea of 3D imaging is to give us a really good idea in terms of shape, in terms of size, about 98% accurate in terms of size. With shape, I do a little bit better than vector. And here she is before her 3D imaging, and this is her real surgical results after. A lovely patient of ours after breast augmentation using silicone implants. Looks amazing, feels natural, great cleavage. Tiny little scar underneath in the fold of the breast. I'm really trying to get in there to show you guys, but it seals so nicely you don't even see it. It's natural, she's very happy. It's a lot about cleavage and anatomical harmony than it is about size. So it's not about size, it's about harmony, and looks awesome. Thank you for sharing.